My name is Cotton Whitling, and I am presenting on the biomechanics of a jump shot in basketball. So as you can see here, the normal jump shot is broken into three phases by those red bars. So the first phase is the preparation, the second is the execution, and the third is the follow-through phase. So the first phrase um, is generally the approach and stance. So coaches will teach this often with some acronym. A common one is BEEF, so base, eyes, elbow, follow through. And the approach and stance are mainly about the base and then eyes. So as you can see on the picture to the right here, he's stepping into it, so it's a 1 foot down and then the next one. But you can also do a jump stop, so both feet land at the same time. And then you catch the ball in stance, balanced, and with your feet staggered. So the shooting foot is slightly forward. Um, and then for the stance, you just want your joints generally aligned, and then your eyes are up on the rim. The next phase is the execution phase. As you can see here, he's elevating, he's pushing off through his feet and then up through his legs. Coaches will teach players to jump straight up and down when shooting, but if you watch in games, most of the time they're jumping in some direction. And then as they elevate, they raise the ball up to head height, and then for the release, the shooting arm begins to straighten, and then the wrist is flipped and the ball goes off, usually the middle or one of the two fingers next to it. And often coaches will look at the follow through to infer things about the release. So as we show on this next slide, here's the follow through, and they'll look at the wrist and fingers to judge the spin on the ball and also the arc of the ball. Most coaches will teach to hold the follow through until the ball hits the rim, and the elbow and middle finger are in line with the rim. And then once again with landing, you want it to be straight up and down, still aligned, and with your legs bent. Often you'll see players landing off balance or on one leg, and this can increase risk of injury. So that brings us to injuries. Some common acute injuries are ankle sprains. They're common across all sports and also in basketball. It's often caused by landing or cutting, so that's very common in the preparation and follow through phases. And the most common ankle sprain is inversion, so the picture to the far left of that image. And then the other acute injury I looked at was ACL injuries. Once again, it's often landing or cutting, so it's common in the preparation and follow through phases. And I thought it was interesting. I found a study that found about 30% of ACL injuries were during or directly following contact. So while they are caused by forces acting on the knee at a dangerous angle, it can also be affected by external forces. And then the overuse or repetitive injuries that I looked at were patellar inflammation and shoulder bursitis. So for patellar inflammation, it's affected by all three phases. It's just that repetitive jumping and cutting and then landing can cause the patella to become inflamed. And especially in basketball where you have to practice your jump shot a lot to be good at it, that inflammation is common. And the other one I looked at, just shoulder bursitis, it's the exact same thing where that repetitive motion, especially when you're lifting your arms above your head with an added force of the ball, can cause inflammation in that area as well. So some acute biomechanical factors that come into play with the ankle inversion or the ACL are, of course, so inversion of the ankle. So that twisting, it can be caused by an uneven surface or a force like the ground reaction force acting on the ankle while it's in a higher at risk angle. And then also for the knee, you can see the picture on the right, picture of the valgus force on the knee, and that angle can be used because it is greatly related to ACL injury. Both injuries are just caused by joint moments at different angles. So that force on the angle causes tear of ligament or tendon. And then due to those injuries, there can be increased range of motion or stretch due to the ligament damage. And that can also play a role in injuries afterwards. So if someone sprains their ankle and it doesn't heal correctly, they can be at higher risk for spraining it again. For the overuse or repetitive injuries, you can see the picture on the right here is a picture of the shoulder, and that light blue section is the shoulder bursa. And both of the repetitive injuries that I chose, it's just inflammation. So we all know how inflammation is generally related to ice principles, and that repetition of shooting can cause inflammation in multiple body parts, most commonly in the shoulder, though, or in the patella. So some training interventions. Looking at it from a strength perspective, most strength and conditioning coaches will focus on proper technique because they're all about preventing injuries first, and then after that you're trying to increase strength for performance. So along with that proper technique, you want to look at mobility and muscle balance because both of those play such a large role. And so when you look at the holistic view of strength, you can look at technique and fix things like valgus knee movement in a squat or lack of ankle mobility in different workouts. And then something else that plays into that is just appropriate resting. For athletes to perform at their highest, you want them to be training a lot, but they also need to rest and recover. And so creating different treatments and also training plans so that they do have enough rest and don't have to worry about inflammation of different areas can also help prevent injuries, especially the repetitive ones. Okay, and then looking at equipment. For basketball, lots of people look at shoes. It's generally accepted that they should have a wide base and then good support. And it's interesting to see that basketball shoes are still trending towards low top, which most people would say puts players at higher risk for ankle injury. And even between low tops, you can see a large difference. If you've ever played in not very supportive low top basketball shoes, often you'll feel your foot twisting in the shoe, and stuff like that can really affect risk of injury. And then also you can look at braces or taping, which we've talked about in this class and how they're questionable. But lots of basketball teams still require ankle taping or braces. And then also knee braces are not that uncommon in the sport, although they are less common than in sports like football, where whole lines will wear knee braces on both knees. So it's still questionable about the long-term effect and how beneficial these braces and taping techniques are, but they are commonly accepted. And then one other thing to look at for this is just game regulations because of how basketball is played. Different regulations have been put in place to try to create safer environments for players. So one of those has just been general like hand checking and contact. When you're playing basketball, that's been tightened down on, so there's less contact and a lower risk of injury there. And then also regulations about landing zone and not undercutting players, as you can see on the right here. There's a famous undercutting of Kawhi Leonard while he's shooting, and you can see he landed on the opposing player's foot. And so removing added risks like those can also help to reduce the risk of injury in a basketball jump shot. And here are my references.